I remember being at my friend's house. Her mother was a high school chemistry teacher, which was fairly unusual for women in that day. I remember her mom saying to us, "You girls should go to medical school, you should both be doctors, and you should both take care of women. That would be a great specialty." I ended up joining the Navy and doing my 3 years of residency training at the Naval Hospital in Bethesda. And after that, at that time, the payback was 2 years. So I got sent to Puerto Rico for 2 years to work at the Naval Hospital that they had there, delivering babies, being one of the 2 OB-GYNs. It was a very sort of a strong character building experience, and it was a huge experience for my medical career. I just always was attracted to OB-GYN, and some people will tell you, oh, they tried everything, they liked everything. But for me, I always just wanted to do the OB-GYN. I do everything from preventative care, the maintenance of health, keeping women healthy, and that can be from someone as young as a teenager all the way to, I have patients in their 90s. I think a lot of people describe me as no nonsense. When they come to me, they ask me a question, we're faced with a situation, I tell them the bottom line. I'm a very bottom line kind of person. This is what it is. This is what it means. I'm good at talking to them in terms they can understand. So I don't look at my schedule. I don't look at what time it is when I go in the room, what time it is when I start to talk to you. I spend all the time that you need, and I think I'm good at sensing when someone needs more time. I see people everywhere I go. I see my patients. My family even thinks it's funny if we go somewhere and we'll come home and they'll say, "You didn't see anyone you know, Mom." I have a patient, I just saw her the other day. Before her surgery, I remember very clearly, I went to see her in the day stay area at St. Joe's, and she said, "I said prayers for you last night." And I loved it because I can use all the help I can get, and I really believe in that strong help. Delivering a baby is just seeing a miracle. It's almost a religious experience. You get to see God every time you do it. It's a miracle, and it doesn't matter if it's uncomplicated or complicated, or it's a surgical delivery or a natural delivery. It's just the most rewarding thing that I've ever done, is delivering babies.